camera lenses, all that in it. We're also going to do basin sets for all Moc surgeries, not just laparoscopic. So I wanted to talk for a minute about how to open a basin set. Did y'all see one of these in the hospital last? Tell me about it. So basin sets are wrapped just like anything else, so that you can open them and not contaminate the inside of it. So it's the same principles that you always use. You're not grabbing over, you're always grabbing under, holding down. And here I have a cup. I pull down. And now if I want to turn this around so that I can not contaminate the inside, I'm going to use that. And pull it. So now I have a sterile thing. Where should my sterile thing be? Exactly. Not a foot away, certainly not 5 feet away. So put it next to your table. The farther away it is, the more chance it's going to get contaminated while you're on this. In here, I'll touch it, I'll show you. In here is all this stuff that I need. I showed you one of these before in class, I think, right? So on Friday, I think this Friday, I don't know. One of these Fridays, y'all are all going to build a basin set for yourself, depending on what surgery you're doing. So you'll have all the stuff, and there's a list of stuff that is allowed to go in it. So enjoy that. All right, what else do we need to talk about before I do? I don't know. I'm gonna go ahead and get sterile-ish. Sterile-ish. Because, you know. And then Kayla is going to help me with a few things like open my pants. So with laparoscopic, you can open that hard pan before you scrub, or you can wait and have your circulator do it. I don't really have a preference, but we're going to talk about a few things about this.
You mean me?
Yeah, I
Okay.
do.
Okay. So this is our laparoscopic tray. So you open it the same way you would our regular trays, up and over. Check filter and all that kind of good stuff. So this has 2 layers to it. So there's a set of handles here and a set of handles here, right? So we don't have anything. We haven't had anything that have layers, right? So you have to be able to see the indicator on both the top layer and the bottom layer. If you cannot, you can pick up the top layer, check for the bottom layer, and then take up the whole thing. Okay? If you do that, you can, so if you have to pick up the top layer, you have the top layer up and say, okay, well, I can see my indicator now, we're good. But you don't want to put it back in the tray because you can hit the side and all kinds of cluster stuff. So you pick up the top layer, you set it down on the table, and then you pick up the bottom layer. And then you check for the bottom and hope it's,
Obviously, she would be sterile.
yes, obviously I'd be sterile. And if you want to take the whole thing, you just lift up this and it picks up both layers. So everybody see how that works? Okay.
Alright, so with pretend she never touched all that.
Yep.
So you dropped my indicator. Just throw it back in here. So she just opened it for me. I come here and I can see the top layers good. Now I gotta look without contaminating myself. Do I see the bottom indicator? Do I see it? Yes, I do. Great. So that means I can pick up both. Just this.
Do you have a question?
It was what you just did.
Okay, great. That was easy.
So if you guys will watch what I'm doing, a lot of times is throwing trash in my basin. Now that you have a place to put trash, this is your best thing to do. In fact, the better thing to do is either pick up your basin and throw it underneath. The reason I like that is because I'm gonna use this for something else later probably, so I don't wanna jump that up too bad. Now, I might split this out, let's see what I wanna do. I might split this up. Kinda you will play with your own, setup and figure out what you wanna do. And you will also have a list of stuff that belongs on the manual, which you'll memorize. I'm waiting this right now. Ready. All right, let me make a roll with it. I have another time.
Probably not.
So I'll talk while she's doing that. For a Mayo setup for laparoscopic, we don't do a whole towel roll thing. You're gonna use very few regular instruments over here. So what you're gonna wanna do, these are blue towels, it's just like that. You're just gonna wanna lay stuff flat, so I'm gonna talk about a couple of ways to do that in a minute. The other thing I'm gonna do is get rid of, or get this back on top of there. Once I've got my stringer out there, I don't need to waste my table space like that. If I just wanna take extra stuff out, I can lay this on here. And not lose table space. Alright. Good. Let me see what else. Oh, let's open this pan. So in this pan right here is your scopes, light cord, camera, bogey cord. That should be it. Yep. So what has to happen with this is your circulator has to open this for you after you're sterile. So she's gonna open that basically the same way I open this basin or anything else that's wrapped to go to it.
These are OR specific. So this one says OR2.
Mhm.
There's two sets, so that you have to use OR2 in OR2, okay? Or else it won't work. And you just open it just like you would flour anything else.
Don't have your circulator unwrap this, but keep going, until you're ready to get it. Because people in the past have thought, oh, let's get everything open. But then you have to leave this somewhere, and there's people walking everywhere, and it gets contaminated. So really, this should be open immediately when you're ready to open it. So what we see on top is a pass indicator. I can also see through the top that there's one on the next level, but this is a 2-level tray, so I gotta kind of do the same thing as I did over there. So I'm gonna take the lid off and I'm gonna hand it to her. I don't need that. Then I'm gonna pick up the top layer and I'm gonna look for my indicator on the bottom. And I see it, so I'm good. If I didn't see it, then what? I gotta get rid of this, get some new gloves, right? So what I didn't do was take it straight to my table. Probably, because I know this is good, here's what I'm gonna do. Set this down, and I can take the whole pan with me. While she checks the wrapper though, I can't touch this to my table or my gown.
Yeah, it's got no holes in it.
Yeah, no holes. I say there's no holes. So you don't want to clutter your table with all this box, basically. So what I'm doing is taking the stuff out and handing it to her layer by layer. And then I'm gonna take my cords. While I'm doing this, you need to take a minute to make, first of all, when you pack these trays, do them right. And then when you get your stuff out at your table, take a minute to do this too, because you're gonna come to the field and hate yourself if you have knots or tangles or whatever. So I'm gonna show you a couple ways to set this up. I use my basin and I put order of use. So in the bottom, the bogey cord is kind of low on my totem pole right now. So So you thought cords are bad with those 2 little cords you had, and you had no idea. So, if you, I should say, when you get this surgery assigned to you, you have to spend some time in the lab practicing this because you're not just going to come in and be able to do this. You're not. You're going to fall on your face. So, do yourself a favor and practice it. The other thing that's in this tray is this little thing that needs to be peel packed. This little thing is important if you want that light cord to fit on your endoscope. Do not lose this thing. Seriously, do not.
And don't leave it on the scope.
Yeah, don't leave it attached to the scope or whatever. I'm gonna leave. All right. The other thing we already opened was like our insufflation tubing, which has to go over here also, and that'll be pretty much the first thing to go off. Because once we make the incision, we're gonna do that first. And we have, what are these? Y'all know what these are.
Endoscopic
What's this?
clipper clip? Endoscopic clip plier?
Really good clip and plier, right? And
Endo clip? Endoscopic, oh, the pouch.
GIA.
Yes. Oh.
Okay. You need to know the difference between these two. What do I use for the appendectomy? And I use this for
Ligation.
Lab?
the gallbladder. Yes, we're ligating in the gallbladder. So for our Moc surgeries, do not come to an appendix with this, and do not come to a gallbladder with this. That just tells me you didn't prepare, basically. So do your homework. What else? Here, help me with this sheet. I know it's a lot. I'm gonna let a lawyer too while you. do all that.
Oh, it says never hand off any equipment or instruments, only this.
Yes, so people decide for some reason that they know what is needed out of here. And they want to get rid of everything else. It's a very bad idea. You're not the surgeon, so you don't know. So you can get rid of the pan like I did, but don't get rid of anything in it and say, oh, we're not going to need that. Because sure as the world, you're going to need it every time. So make sure you're not.
Surgeons like to ask for things that you don't have.
Oh, yeah. It's like they look over there and see what you don't have. And have for it.
Did you? Oh, wrap stuff.
So those are my sort of peers, and I'll put those there. Now, in the basin set, you are going to be able to put your blades in here in the package. That's the way a new basin set will come. But what do we have to do before we count?
Open
You
it
have to
up and
open
put
this
it in your
up.
sharps.
Don't be counting one blade. You have to open this up, know what's in it. You got 2 blades in here. You have a 15 and an 11. If you're scrubbing microscopic with me, I want an 11 always, and I want it on a 3 handle always. What's next, Kayla? Oh yeah, so let's do that. So we got a few more packages. I just want to talk about some special stuff that we're going to open. That you need your circulator to help you with. You're not going to try to flip any of this stuff. So you're not going to try to flip these on your table. That will never happen. So we have one thing to show you. Let's do the bag. So the endo bag and these 2 things kind of get wrapped in a, whatever. Just,
Okay.
So y'all will have to practice some of this too to make sure you know what you're doing. Because it's not as easy as you might think.
And it's not easy to wrap either.
No, it's not.
Right.
So if you're circulating, you're getting graded too during Moc surgeries. So your ability to do what Kayla's doing right now and not contaminate things would be important.
So funny. Well, because I was concentrating on not letting go. We don't like to flip trope cars either.
No, they bounce everywhere.
And poke holes. Because they're sharp on it sometimes.
Let's not do that.
You don't want me to open this one?
What do you do? Open it. So I want everybody just to review, make sure everybody remembers when you're taking something out of a peel pack, you gotta not contaminate. So this is kind of on both of us at this point to not contaminate, right? So you gotta watch your hands here and here and make sure you're doing your stuff. I probably don't need this, but whatever. I need that though. So this thing is the suction irrigator, and it comes in a big old box like that, so there's no way that's gonna flip out of there. So it's just like a big Raytech box almost. You just peel that back, and there's tape because we reuse. Y'all know how it is. So this is a tricky thing because you need to kind of use both hands, honestly, or know what you're grabbing at least. So what I have in here is this whole thing, and then I have my tip as well. So don't leave your tip. You can't use this without the tip. So be careful when you're doing this, that you're not rubbing your sleeve here, that you're letting this drag and touch here, you know, you gotta be focused on what you're doing, basically. Alright.
So just like you pick up your glove and your open glove and you pick straight up and out, same kind of concept. Pick up and out.
So I'm gonna put that over here somewhere. So I'll do that next. Now let's talk about the way I'm setting up is the way I'm gonna set up. But there are different ways. You need the same things. It's just how you set up your table is kind of up to you. And I want you to, when you're practicing, I want you to try different ways so you can kind of find what you feel comfortable with. And you may come in surgery and realize, oh, this doesn't work at all. And then you'll try a different way. But at least I want you to see a few ways. So what I'm doing, what I like to do is put I like to put most of my laparoscopic stuff up here as well, so that I never have to reach back here unless they ask for something that I don't anticipate. So y'all just heard the steps. The ones of you who did the project should know for sure. What am I going to need out of this tray?
Endoscopic grasper.
A grasper, I have that here.
Endoscopic scissors.
Scissors, I have here.
J-hook.
J-hook. I have a right angle just because, and I might have a Maryland, but I don't see a Maryland in here. Oh yeah, there. So I would probably have a Maryland, maybe not the right angle. So I would probably have those 4 things. And if I know my steps, I can put them in order. So what am I going to do first? If I'm doing a gallbladder, what am I going to do first, gallbladder people?
Grab it. Grasp it.
Grab it.
Grasp it.
Yes, grab it. Oh, grab it, that's right. What am I gonna grab it with?
The grasper.
Yeah, so I'm putting that first, and then what am I putting next?
The scissors.
Scissors usually last, because I'm gonna dissect first, right?
Right.
Maryland.
So I'll put my Maryland and my J-hook next. Whoa, what's going on here? And then I'm gonna put my grasper there. So they're in order, and I can just pick up and serve, hopefully, right? We'll see about that. We'll see if I can do that. Now, here's what I'll say about cords. This is how I do this, but this is not the only way. You can line up all of this right here, and then you'll, as soon as you've thrown them off, your table will be empty. You can also put them on your mayo, but I don't love it. Here's a couple of things. If you decide you want to put these on your mayo, you cannot put your knife up there. And you really need to put a towel down first before you put your stuff down, because you're going to screw up your mayo setup if you do that. So until you're a little more experienced, that probably isn't going to work so well for you. Just giving you a tip there. I'll show you how the basin thing works. But what else, Kayla?
Big stand, it says how to bring stand. Rivera technique, the song technique.
Okay, so tomorrow's lecture, we're going to talk in detail about 2 approaches. The one y'all talked about today, mostly the Ferris needle. There's also another, so that's a very small, like puncture with an 11 blade and a Verus needle and blind. There is another way to do it with a Hassan trocar. It comes with a syringe to blow up. It has a little cuff right here, and that blows it up and holds it in place. To do this though, you have to do a cut down further into the abdomen to put this in, and then you insufflate through here. So depending on your surgeon for mock surgery, they will tell you what method they're going to use. That will determine which of these you need and what instruments you need. Because if you're doing Hassan cut down, you need a little bit extra, and you need some extra suture. So we'll learn about that tomorrow. What else?
Do not put scopes on the nail.
Don't put your scopes on the mail stand. Good point. Good. For one reason, y'all know how unstable that is when you go over here. You know how I can go crazy, right? The last thing you want to do is drop a $3,000 scope on the floor because you're going to break it if you drop this thing. So leave them right here where my favorite place. That's what I do. So, you know, when you work for a hospital after 5 years, you can do what you want to do. Break their scopes if you want to, but not mine. So don't put my scopes on your makeup. What else?
The hospital's gonna get, if you break too many scopes.
They're gonna get on you. That's
They're
right.
gonna get on you too. Local syringe not allowed on mail stand except for
Okay.
a trocar.
Let's go ahead and force them. Okay. So with a laparoscopic, let me just say this, with all your surgeries, you're gonna have local loaded into a syringe like you did in checkoffs today. As a general rule, you're not gonna put a syringe on your mail stand. That's not good sharp safety, because too many hands are going back and forth to that mail stand, so not a good idea. In laparoscopic, it's tempting because the steps are like this. You hand in the local first, then you hand in the knife, and then you put the trocar in, and they go back to local, knife, trocar, local, knife, trocar. So you're tempted to like leave it there, and you'll see how quickly your wheels fall off, and you'll have an uncapped mayo on, hypo on your mayo, and all kinds of bad stuff. So that's, right now while you're calm and listening to me, I'm telling you that. Don't put your hypo on your mayo. All right, read me some. Yeah, I've heard it 19 times today. But y'all in mock surgery will do all this just like you check all this. And while I'm at it, let's fill our basins all the way to the top, y'all. Some of y'all aren't getting all the way to 1,000.
Okay, well, that's probably me.
Yeah, it is.
It was you.
So here's the reason it's
Your
important.
ball
I know.
was tilting.
I'm holding it. Let me set it. The reason this is important is because remember we talked about, can we fill the graph? Can you see it?
Yeah, well, I was just gonna,
Let's pretend you didn't rehab that.
Yeah.
The reason this is important is because you have to account for how much irrigation they use. The best way for you to do that is to know that you started with 1,000. If you haven't looked at your basins, they have the little markings, right?
and y'all, this is 1,000.
Yeah.
So you need to start with 1,000 for it all.
Yes, for all of it. Okay. I'm gonna mix two meds. I'll do this a lot in mock surgery so you get some experience, but I want you to see it. They do this, did I explain this before in the lecture why they mix meds? Does anybody remember anything I said?
I know.
Last longer, one is
Say
Say,
it loud.
say it louder.
Sorry.
one is fast acting, one is slower acting.
Yes, and one lasts longer than the other, so that's why I will mix. So if we're mixing meds, we need two cups, right? So go ahead and just read these.
You want me to read them both, or read the last two?
Read one, okay, it's not long.
Cortisant, Hurricane with Epi, expiration 2019.
4%. Marketing.
Excuse me, sorry.
Starts 3/19.
It's next to my jacket. Don't be afraid.
Okay. There's your Hurricane.
Oh, I don't have a skin marker. Fabulous.
Yeah, I did that. I just grabbed one.
She.
Sorry. It'll work. Hold it. Alright. 5% lidocaine plain, 7.2.
5% lidocaine plain, 722. So when we mix meds, we're going to use 2 cups, it says it already, and we're going to use 1 syringe. Okay. Now, if you're mixing, our labels are too small for this, but you're going to make do. So you're going to have to stick like 2 of these on here. Good luck with that. Now, the way I mix is, first of all, let's talk about this today. I'm jumping around, sorry. I want y'all to be precise. When you're pulling out of a cup, you need to pull 10. Don't pull 10 and a half, don't pull whatever. Somebody said yesterday, I don't know who, I said, why are you pulling more than 10? And they said, well, I'm going to get rid of it. And I said, you don't have time to do that. That's an extra step that you don't have time to do. So be precise. I'm pulling 5 of each. And it should be that quick with 1 hand. Now I got air in the top, I'll fix it. But you have got to be quick, and you all need to learn to do this with 1 hand. Yeah, hand me an Accepto. I don't need it for this case, but we're going to talk about that while I'm here. So make sure you're practicing doing this stuff with 1 hand because
As long as you're going to do a tractor too.
yeah, most of the time one of your hands. All right, so let me talk about Accepto while I'm here. You don't need this for laparoscopic surgery. This is a leftover from today's checkoff. Again, with the 2-handed business, you can't do that. So I need you to practice both hands, left and right, 1-handed. So it should look like this. Just like that.
Feeling nice up over.
You don't have 2 hands to do basically anything in this job, so you've got to know how to do this. I need some more leftovers. Forgot that part. What else? I'll go ahead and talk for a minute. We'll talk about this tomorrow. If I do the Hassan method, I'm going to have 2 sutures right at the beginning. It's not just for closing. So I think somebody had this. No, you didn't. This is for when they cut down through the umbilicus. They will actually thread a suture through either side of it. It's like a traction suture to hold that wound open while they get the protar in. So if you know you have those right at the beginning, you could even put them here. I'm fine with that. Or just have them on hand. Know which ones to do first. Yeah, good. All right, what's next on my sheet?
How to arrange course, how to pass on to the house surgery.
Okay, so let's get sterile then. I'm bringing my sheet, put my sheet on the table so I sterile, it's fine. Blue line. Somebody sign her, please.
I'll get that.
I'm also not using people for clothing.
terrible at walking to a case where somebody else is set up the table.
Because you just go, I don't know where that is. Especially a big case like total.
All right, so this is a laparoscopic crate, which you are not going to have, but I wanted to show it to you because
It's
cool.
fun.
And the hospitals will have one hopefully.
Be haunted, believe it or not.
Somebody click this for me. So it has a bigger opening than your laparotomy drape, you see that. And then these little guys are Velcro. And some of them have pouches that are closed on the side and some of them don't. This one is closed partially, but you can run your cords through it and it kind of helps you contain your cords rather than having to use 47 gears, which nobody wants to do. Oh, you know what, actually, so y'all do it. For this room, you have to cross the room. So, here's why. Appendix is here, gallbladder is here. Surgeon always stands across because the instruments are long, right? So they're working that way. So in this room, you have to come around the bed. The other room, you don't. So, y'all give me some space to let me do my thing.
So you're gonna bring your back table around as well?
Yep.
So you'll need to shuffle this way.
I'm probably gonna go ahead and pull this basin up if she wants to help me. She's gonna be nice to me. Then it's here and she can reach it, you don't have to. But, you know, give them something to do.
Most of them will.
Now, here's how this has to work when you're crossing the room. I can't walk between here, I gotta push it to there and then I gotta come to the end and not contaminate the bed with my butt or my table with my butt. So make sure you practice this if you have to cross your room.
So should we have set up a table opposite,
No,
just like that?
yep. No, I set it up backwards, so yeah, it's fine.
Okay.
Yeah, I know. I'm just. We're ready, Megan?
Yeah, sorry.
Oh, let's talk about this. We haven't done this yet. We kind of did it, but we kind of haven't. So when you're passing a cord to a circulator who's standing there, I need you to be really careful about, it doesn't look like this. Does everybody see it does not look like this?
Mhm.
That's not enough. You gotta make sure that it's enough for her to grab, and you gotta make sure that it doesn't bounce back and hit you or any sort of thing. With the insufflation tubing, this filter end goes off the field. So you gotta make sure you're putting the right thing off. Now, this thing does not plug into anything on here. So we just pretend.
We're just putting it up there last time, but
Whatever you wanna do.
I don't know if it'll do that this time.
I'll just hold it.
Next will be my camera, because that is gonna be my next thing. So again, with the cords, you have to be careful that you're not contaminating, that you're not handing off the wrong end of it, that you're not taking 3 years to do all of this. Nobody's got any patience for that. Light cord, the long pointy end goes off to the circulator. So if you're circulating, you're just as responsible if the wrong end goes off because you're not paying attention. So you, as a circulator, you should be able to stop errors like that. What happens if I hand it off the wrong end of the light cord though? Yeah, I mean, I can't really recover that, can I? So that would be.
Making these pouches are nice. Can I request this for my laparoscopic cases? I won't refuse to operate unless I have this drape.
Too bad. All right, then my last thing is this suction irrigator. So let's talk about this Moc Surg. So this end is what the surgeon uses. These are his buttons that he pushes right here. It's her. That's right, her. And then this whole end of this thing goes off. So you have two ends. You have this that hooks up to something, the pump, such, you know. And then this goes to your bag of fluid that would be hanging there. So you gotta make sure you get all of this whole thing off your circulation. So, it's a little cumbersome. Yes, big and crazy. Also does not actually plug into anything in our ORs. So we just put it on the.
We like to pretend.
What does it actually look like? A bag of fluid and suction, because it's a suction ear.
Yeah.
Okay.
So I'm gonna try to flip my table and then have a sec. And, right now though, whatever method she's gonna use to get in, which one? There. What? There is one. I do have sutures. Help me out. Sure, let's do a timeout. Megan, we're good.
I'm over here.
Let's do it. Okay, everybody pay attention. This is a real timeout. You will have to, in Moc Surg, you'll have to write this board, with your, let's do it, Megan. Let's do it. We didn't count, but we'll,
Oh, should we?
make it up. Okay, let's talk about counting in laparoscopic. For our purposes here, we will count, you will count out of this tray, the bottom part, not the top stuff. And you will count salts and sharps. At the end of your case, you won't count, you'll only count salts and sharps. That is kind of hospital specific. I think we talked about that in the lecture, right? Your hospital kind of determines what they want. So bigger hospitals may be more likely to have you count everything because they are anticipating sicker patients and possible open case.
Yeah, it's like if it says laparoscopic gallbladder, we don't usually count a stringer, but if it says possible open or possible laparotomy or possible whatever, we'll go ahead and count the stringer.
I'll recount these to make sure I don't say that. So go ahead, I got two blades, one hypo, 3 needles. Oh, okay.
Well, you can go ahead and we'll start
Make a
with
bigger one. Yeah, let's do the board, because I want you to see that. We're gonna start with zeros.
Hey, well, where did you put that gown card that you wanted
in my pocket.
Oh,
That's where everything goes. Extra blades, extra. We need to talk about, we don't need to burn a hole. I don't want to.
All right, so, yeah, your circulator, when you're circulating, you're gonna have to keep that board written correctly. So as soon as the count's done and you're setting up, the circulator's gonna go over here and write this up. So we don't have laps, laparoscopic, we have 10 Raytex, I have 2 blades, I have 1, 2, 3 needles, I have 1 hypo. I don't have any bogey tips or scratch pads in this case. The other thing we have to count though is what? What do you think?
The chokers?
No?
Oh, Fred.
Remember Fred? So it's a 3-piece deal. 1,
Huh.
2, 3. And I usually just leave that in there because once you take that off, you don't need it again. This gets stuck on the drape and you squeeze the thread on the drape. And tomorrow I'll show you a stroke warmer too in lecture yet. Okay.
Those are fancy.
All right, so we're going to count the board. So Megan's going to write the board the way you should be writing the board when you are circulating in Moc surgeries. So you're going to be graded on the, go ahead and write your procedure, patient, all that. Gallbladder. So this is a laparoscopic cholecystectomy, right? So we don't need to write gallbladder. TH. O-L-E.
Patient, anyway.
Make something up.
Date of birth,
Make sure you get that right.
Christmas.
Poor Betty White is not Kayla doing her gallbladder.
Allergies? No.
Christmas.
No drug allergies.
Date of birth, Christmas.
That's what, fix it. Put a date to it.
Right.
I don't know what year she was born.
It doesn't matter.
A long
She's like almost 100 probably.
February 30th.
She is 99, actually. She'll be 100.
Okay, so like 22.
1922. You gotta be specific.
There you go.
Yeah.
Great, perfect.
All right, so NKDA means no known drug allergies. Everybody know that?
Mhm.
What do you do now? Okay, so when we're gonna do our
They say
timeout.
Yeah.
Okay, so when we're gonna do a timeout, the name's going to do it correctly, and this is what you have to do. So,
We are here with patient Betty White for a lab chole. Date of birth 12/25/1922. No known drug allergies. Everybody agree?
I agree.
so when that happens, everybody stops, pays attention, all that, right?
But I have a question. Are
Yes.
you going to ask a name? Because on the surgery, I had a timeout, and then she asked my name and her name to everybody's name. And then,
Oh, yeah, that's
what
a
is your
thing.
name? And then
Okay. You have to
Yeah,
Oh,
your
yeah.
name.
We're not going to here,
Oh.
but some hospitals do. We're not doing that, because I ain't gonna
And we don't.
Yes, we know you're gonna do. But they do that in some hospitals for charting purposes, so.
And because sometimes you don't see the same tech twice. Or for a long time.
Yeah, true. All right, so I'm gonna leave this, when we're done, I'm gonna leave this so that y'all can play with it for a few minutes. You need to know how to plug the stuff in, that's ordinary circulating.
In this room and the other room.
Both of them. Okay, so let's go ahead with the theirs. Well, first of all, the first thing I have to do is detect.
Don't turn that lights off yet.
First thing I have to do as a tech is connect all this. I have to make sure my light is on over here, so Megan, light on please. And I have to white balance my camera. So what that means is I'm gonna use something white like the Ray Tech. Once my light is on, yeah, watch out. And I gotta remember how to do this. So how do I white balance the screen?
You have to go.
I think it's the menu button and then you have to slide over.
Yeah, and then go down one more.
Okay, so I go down to white balance and then I hit enter, white balance, okay. Does everybody see this? If you
Yes.
can't see the screen, you need to come around. So we're going to menu, I'm going down to white balance, I'm hitting okay, and then I hold it to my sponge, and then when it says white balance okay, then I'm good. Okay? Everybody good? So practice that. Now the thing I can't do is if she's about to do a quick Hassan cut down, it might be 5 minutes till she's ready for this camera. I cannot leave this thing laying here, because what's gonna happen?
It's gonna fall.
Oh.
It's gonna fall, is that what y'all said? Let's just see what happens, okay.
Oh my gosh, it'll give me anxiety.
Okay.
Don't get me.
Nice. Okay.
Don't touch it.
Oh my gosh.
I should use one first. Here.
Yeah, have some local. Okay.
Yeah, that's good.
Where do I look at it? Right in the middle.
And then what attaches to this Ferris wheel, y'all? The suction tubing?
Insufflation tubing.
Insulation tubing. So this, if you're doing Ferris, so what we do is let this insufflate, and we'll sit here for 2 or 3, 4, 5 minutes. I don't know. Depends on how old their equipment is. It'll blow this belly up, and we'll just kind of wait. So in that moment, you have a couple of minutes. If they're doing a Hassan, you're not going to have those minutes because you're going to be passing stuff constantly. Now the step we skipped was like cokers. So somebody had this in their presentation. They would use like cokers or something to grasp the edges of the incision and hold it open, or to pull up. Was it Sarah was talking
Yeah.
about that, right? To pull up the abdominal wall so you don't poke that virus in there. So that's kind of what these are for. Or you use the cokers for the same thing in the Hassan method to Oh, good, that's enough. So let's look at what's happened.
Oh, burned it, yeah.
Does everybody see?
Yes.
Yeah.
Just how long was that? Maybe 2 minutes?
Yeah.
Not even.
Yeah,
I mean, that's
so
without, skin product, so.
Kayla's having an anxiety attack. Because as a tech, that should give you an anxiety attack if you don't get your light turned off. So if you go ahead and white balance, that's great, but make sure that she's standing right there going to cut it off. Just put it on standby, is what we call it. You don't actually cut the whole machine off, but there's a button here that pushes on and off on the screen. All right, so we're insufflated. What's next? What's next?
Trocar.
The trocar.
What's the Kayla said? Trocar?
I love the song.
Now let's talk about trocars really quick. Trocars have the obturator, right?
Mhm.
We're about to do this. So you put your trocar in pretty quick, and you hook your insufflation to this so it keeps the pressure that I'm talking. So your big one always goes in your umbilicus. You might use another 10, 11, or 12 somewhere else, depending on your instruments, and we will actually. So I'm glad I have that extra one. So when you pass it to them, it's got to have this piece put in. When you open these, they come in a little peel pack and a little card or something that holds them together, and they're like this. So you have to put them together before you pass them.
And you have to switch the little nubbin.
Yes.
So this little fella is open, meaning the gas can come in and out. Open. This is closed. If you have it open and you put it in, all the little insulation you just put in is just gonna out. Yep. Closed.
And then have the installation ready for them as quickly as possible so they can do that. Then once they're doing this, they're ready to put a camera in. So then the circulator's got to turn that light back on. So that's your job to kind of communicate back and forth. And give them a camera. And you see where my hand is right now? This is your job all through laparoscopic. Even though you're doing 100 other things, you're helping them get stuff in the trocars because the wiggle on them is hard.
Can I get overheads off and ring lights
Yeah.
down?
So this is something that happens in laparoscopic. The room lights will go down. Or no, yeah, these are
Ring lights down?
overhead she means.
Yep.
Like these.
These two. Well, you can have one.
Yeah, that's what I mean. So, room lights are the ones in the ceiling, right? If I want to, which I do, I'm gonna keep one for you because,
That one off.
contaminate my table, that's bad.
Yeah.
Thanks.
It's okay, I fell off earlier. I contaminated the field.
Great.
Sorry. I just put it back.
What was
You guys
it?
are killing me anyway.
I know.
Told you. You didn't want me.
Alright.
Someone got the bed
I need
clicker.
some more,
Can the bed go down some?
needle drivers, probably.
Maybe at your leg.
I can save this one. I cannot save this.
Oh, we're really, okay.
We're really doing it. Maybe I need some needle drivers. Somebody grab me 2 needle drivers in a package. Thank you.
And samples?
Ah, yeah.
What did you say?
Okay, that's great, thank you. I'm gonna take this 9.
Okay.
You want new gloves?
Oh yeah, can I have some local?
No, we didn't touch
So
it.
locables first?
And I only touched the
We have local before I saw it local.
0.5%, 4%. Mix,
Mixy,
all
mixy.
that. So yeah, you gotta
So
announce
we
all
refill,
this.
we refill it before.
So it does get complicated when you start to mix, because you gotta say all of that stuff. Yeah.
Oh.
I did it without even thinking, so pay attention to what I'm saying right now.
Ooh,
Those
little
two
beans
needles
are
that are
fun.
contaminated are the needle drivers. I've already pulled the needles out of the packet, I basically couldn't save them. So I dropped them in here, but I just instinctively said to Megan, so these are the two needles that we're gonna have to count them, because you can't forget where they are, she's gotta count them. Or at least gotta be able to see them later, you just leave them there.
Can I have some more local?
I need some more sutures, please. Buy those bigger needles if you come.
Nice.
You see where my knife and my pipe are going back every time, right?
Yes.
This is super important. You cannot leave this stuff up here with this stuff all happening at the same time, because you are going to regret it. I know that she's already in, so we don't need all this stuff. I'm taking it off. I'm only going to keep the stuff I know she's going to need later.
Can you move this mask down?
So this happens, y'all. Can you move this mask down? Sure. You just do it. They gotta have room to work. And you gotta be careful too that you don't get too close, because their elbow here is now longer because of all the long instruments they're using. Megan, I have
Can you pull this grasper for me?
1, 2.
Don't pull my gallbladder off.
Oh. Oh, like your bright pink gallbladder?
Yeah.
Awesome. So let's talk about the camera while we're here. So this is the real thing that they'll ask you to hold the grasper. They may ask you to hold the camera.
Yeah, I can pull that too.
So,
Well,
here's the thing. Now, hold on, let me talk about this. Just stop for a minute.
can we hold that one?
Just let go of that. So with your camera, so this is the inside of the trocar. This is not what they want to see. You have to be outside of that, but then you can push in or out to zoom in, basically. You also have to, you need to play with this during practice. You need to know, like which way to go. Because the orientation of this is, it feels backwards to you. It's like playing a video game almost. So if you're really good at video games, you're probably gonna be fine with this, but you have to sometimes stop and orient yourself to gallbladder is here on the body. I'm gonna point the tip of this camera towards that, and that's where I'm gonna be. Oh, we dropped the gallbladder.
We, not me.
So you have to, this takes some practice. You need to be in here working on this. Can you get it?
Well, if I can see. Let me move it up. No, I'm too.
Sure.
It's too
Too far.
far.
A little bit. Yeah. Another third bar. Let's make another third bar.
Okay.
This person has weird names.
Their gallbladder's like in their throat. You know what? Can I have a marking pen? So I don't mess up.
You need to use that?
No. I needed to mark first.
So let's talk about this too while you're here. Good, great. How to find the abdominal wall with your camera. Because a lot of times when they're, take that out of there. When they're looking to say, okay, I want to put it here, they want you to find this, like, where's my finger kind of thing. And then they're going to put their local, well, and they want you to watch and see if you can see, like, where they are. We're at the tip of the trocar. There we go. And then when they come through with their knife, you're still sitting here watching that. So they know they're not puncturing anything. That's why they're here.
You didn't see it?
Do we
After
have another
grading,
paper?
the we're doing it. We had a laparoscopy. You didn't see it?
I was in the other room.
So again, you can find the abdominal wall, watch the tip of the trocar come down in there. Make sure you're not puncturing bowel or any important things or whatever. All right, let's see. Where's that grasper still here? Can't see that. See it? So where are you at?
I don't
You
know, I'm
are
hooking.
right there.
Oh,
So they'll say, find me, find me.
and
And there you are, but you're in my way.
you're in my
You
way.
need to come this way.
Oh, good. Thank goodness you're here.
Don't tear it. If you break that, now we'll die.
Oh, I'm trying to be gentle.
Oh, go up, go up. And then,
Work out for a while.
Yeah, y'all think y'all can.
Uh-huh, y'all are good
Yeah,
at this till you
uh-huh.
try it.
Okay, are we like close?
Well, now it's over here at the spleen, so. You know.
Yeah, but it's on the organs now at
It's
least.
on the organs. See if we can get it in the liver bed. That'd be great.
Well, that's where it came from.
There you go. That's close enough. Just hold it there.
Ha ha! Looks like I got butter now. So y'all
See what's
don't, y'all don't
happening?
understand. It's real hard.
What's happening with my,
I'll take this.
is I'm keeping them close because sometimes during surgery that can get clogged up or whatever. You need to unclog it, or they may need to reposition. It might come out and put it back in. There's any number of reasons. Don't lose those things. All right.
You need to check your list for.
Yeah, we're gonna talk about the like dissection things and we're gonna talk about this tomorrow in class, but generally anything with a little post on it like this can be plugged into a oven.
Like
So
this
that
one.
makes this hot. So you can either use it cold, which is right now, or hot, which is now. So now this is basically oven. So they can use this for any number of things. So that's what it means if I say to you, make this hot, that's what it means. Grab the thing and plug it in. J-hook, L-hook always have to have this. They don't do anything otherwise. It's kind of pointless. That one doesn't really plug into our stuff. It's kind of old and crappy. So yeah, we'll plug this one in here. You can dissect it
No,
a
I don't
bit.
want over there.
Yeah, that's right. So now while she's looking around for a minute, I'm gonna look at my minutes.
This is how my mock surgeries go.
I'm gonna look to see how much she's used. And I'm gonna refill. I'm gonna actually refill accurately. So what I did on my table
Really good
right here is I wrote 7.5. That's how much she's already used. So now I have a full syringe again. I can start from there. Next time it comes back to me, I can do that. That's not that cool what I did.
That's not that cool.
It's my table. I can do what I want. As long as I'm sterile.
Can I have? We have a clip applier. Can I have a clip?
So let's talk about how we hand things to them. You should be putting this in their hand. Just common sense, I think, but you know.
Oh no.
You gotta take them here. So for practical purposes for us, and for you later too, you gotta recognize what your stuff is. This plier and this stapler will not fit in a little 5 trocar like this. So you gotta kind of, when you're opening your table, kind of look. This also will not fit in a 5. So make sure you have enough trocars of the appropriate size that are gonna be useful to you, basically.
How many clips am I gonna use?
3.
On what?
Two on one side and one.
And one
On
On
what structure?
cystic duct.
Yeah.
Cystic duct.
Uh-huh.
The blood vessels.
And a cystic artery.
So how many clips is that total?
Okay, 6.
Just
So
checking.
2 on the side that are staying in the body, and 1 on the side that's coming out.
So clip, clip, clip.
And then what?
And then one on the side that's coming, two on the side
Cut
coming
it?
out.
No, I said clip, clip.
The second
Clip.
Cut it.
Scissors.
So they clamp, that's basically clamping off instead of using like a hemostat or something. You're clamping with those clips and then you're cutting.
Okay. Good.
Isn't that similar to how they cut umbilical cords and clamp and then cut?
Pretty much do that and opened a lot too, so we'll talk about that. So it should be to the point that you don't even have to, they don't have to ask you, you should know. Once they ask for this, that's definitely gonna be the next kind of thing. And she's flipped twice, so.
Sorry.
What's your name?
A grass bird? I don't know. I'm kind of winging it.
Let's use the suction. Okay. Okay, can you hold this, please?
My suction irrigator comes through the car.
So we're gonna do suction irrigator, so I gotta make sure I got the tip for her to put this. Alright, and I'm gonna hold this, help her. I'm gonna help her not lose our cords in the meantime. Because it's not her problem if we lose them, it's mine. Yep. And then I just get to stand here and go. And so the suction irrigator it blows fluid in. So you'll watch it fill up and then you suction it all out. Pretty cool. You can also use the suction.
I don't know where I'm at.
If you have,
There we go.
if you have like the Maryland or the J-hook in there with the Moby on it, you can also use the suction to suction the smoke out. Now some of the newer laparoscopic insufflation systems will have smoke evacuator attached to like your insufflation tubing, which is kind of cool because that's one less step that you have to do.
Okay.
You're ready.
I'm ready. Okay, I guess we'll get it out now. I'll be back.
So this is a big one
Of
too.
course it is.
Now let's talk about this bag. Here at the school, we can't afford to buy these bags. Now these are like $700 and something a piece. So don't launch it, exactly. We're gonna do it the old-fashioned way, so let's do it the old-fashioned way. I know, it's so tempting. So the old-fashioned way is Kelly.
Oh,
Yeah, you need the camera. How do you want to get out there?
well, I don't know. I didn't know you let go of your grasper too. Oh, wait, I need to move up here, don't I? You want to take it out of the belly button?
Yeah, so we're gonna take it out of the belly button. So you move your camera. And then you grasper to grab. So we're gonna grab that thing with this grasper. Hopefully, too far away. And then the old-fashioned way is Kelly in the belly button and try to fish it out of your grasper. Should I try to pull this up and drop this close? Of course. Let's try. Where am I? Where am I?
Wait, I saw me. Turn around.
Oh, you're in the pelvis. My goodness. You are right here. Holy moly, okay.
Well, I said I dropped it, didn't I? Wait, where am I at? Hold on, I gotta go this way.
I know, we killed her for sure. All the infections in the world are happening.
I don't think we contaminated anything.
Well.
She did pretty good suction
Yeah, okay. So this is old school for us. We're gonna grab it with the Kelly. And half the time it's too big to even come out of the belly button, so we're just gonna
I got it.
get out there without breaking it.
It's out.
We need to make some rocks.
Okay, I thought we have a bunch of rocks. I like something there.
Sure, no, that's not the best.
Okay. We still have balloons in beans.
beans are gonna like pop in my hair with beans instead of water.
I made it too fat.
Here, I'll fix it. Watch your finger.
This is not real, y'all. This is real life, though.
I mean, sometimes the gallbladder's real fat and you can't get it out.
So that would just cut some more.
then it's stuck in the bag, and then you gotta open the bag, and ah, we didn't bust him.
Well,
That's
practice,
right.
on practice, are we gonna be surgeon as well? Or how does practice for this gonna work?
Well, we'll talk about that in a minute, so remind me, because I'll forget.
Okay, everybody out.
Everybody out.
Everybody out.
Light off, please.
And are we leaving our specimens on?
Wait,
No, not everybody out.
I know.
She meant,
Everybody out.
Oh,
we got the light off.
I was like,
Yeah, can I have my overheads back on, room lights up, table up?
Did you say you
Mine was
want
good.
these on?
Yeah.
I just want to make sure I got it on.
I want to be able to see.
And now I have to adjust my light back so she can see. I have to hand her pickups with that. If you haven't, loaded the suture in 3 months, you are time to get busy. Because you need to know how to do that now. Right now, I don't need any of this. Right now, I can get rid of my specimens, you know, a cup.
Cups are in the cabinet.
Yeah, this should be trying to clean up, straighten up a little.
It's a thing. It's a thing I know how to do. Scissors, cut.
Get some discount. All right, so sauce, 1, 2, 3.
He looks like the master suture.
8, 9, 10. Bread, 1, 2, 3.
I got him.
Good. Needles, 1 up, 2, 3. Legs. 4, 5. Oh, good. That's your job. Good. 4, 5. So let's do that again. Needles, 1 up, 2, 3, 4, 5. All right. I got
Cut.
1.
I'm ready for Monaco.
I've got 1. Legs, 1, 2.
Needle down.
Where's your second?
Ooh, this is a cool needle.
Alright, we get some dressings. Oh, all this is in the box behind the table right there. I have like all the dressings in the world.
Oh, dressings in Cut.
Do you want them all open?
Yep.
Or, okay.
Look at Taylor.
The other thing I'm gonna start doing right now, the other thing I'm gonna start doing right now is taking my stuff apart, because as soon as she's done with this, like this page, we can open up, my stuff's moving.
You want to flip it or?
Nope. So any of this that I can start unclipping, to come off the field would be great. Taylor?
Yeah. I mean,
Yeah.
I don't get to suture anymore. I know.
Well, hold on. Yeah. Got it. Yep. Okay.
You know what? It's funny because that's exactly how Band-Aids work in real life.
For this one, do you want?
Let's pretend we feel back to that, sorry. I want to that, yeah. So what I'm doing is trying to line up my dressings and stuff, so that while she's suturing, hopefully I can do all my stuff that I need to do. I have everything ready to go. I'm gonna go wet and dry for cleanup. I've got on my resume.
Yes, did you want for my first?
No. I'm gonna, so I cut my scary strips up. You guys haven't really learned all this stuff yet. So we kind of.
No.
So I'm gonna cut my tail up. You'll learn how your surgeon wants it. This surgeon's gonna do however I do. Well, I'm gonna show you a variety. Generally, they will either use like all scary strips, or they will use all tapered, all band-aids, or whatever. So kind of want you to see all of it.
I'd like one of each of those things.
Okay, we have one of each. Great.
Okay, great. Well, okay, I'm good. Could you just cut this? Okay, I'll go with that. If you're ready. Are you ready? Okay, great.
All right, so wet and dry always goes before your bandage. The wet is for prep solution, whatever else we have, blood. We don't want to send that patient home with that, so we always use that. Dry to dry that off because the bandages won't work very well otherwise. Now, the tegaderm is this thing. You're gonna learn this. It's their module 11. Same. I don't know. We still have cardio.
I think it's the last one.
Yeah. So this is a tegaderm. It's like a clear window band-aid type thing.
They're the best.
Yeah, they're great for all sorts of things. Oh, we did this in lab, putting the hole in the grave, right? Okay. So, one of my favorite ways is to cut up a telpa. You know what telpa is? And put little pieces on each one and put a tegaderm, so kind of make your own band-aid. You can kind of up to you to decide like what size this telpa needs to be in there.
If you're at a fancy hospital, they make telpa tegaderms, and
Yeah.
the telpa is already attached to the tegaderm, which is super cool.
So you just put it there, your telpa where you want it, lay your tegaderm down, and then peel this paper off. And it makes a nice waterproof thing for your patient.
They have
So it's a nice, pretty looking
They're
thing.
really good for kids.
And
So
a lot of times
fancy.
you are the ones
And they
doing
really
this.
are waterproof.
Surgeon's like, bye.
Yeah.
Avery had notes or scratches when we go to the beach. We use those because she could go swimming.
Another way you can do it is steri strips. Now with steri strips you need benzoin. So this is old school benzoin, and this is newer school. So what you do is just break this little vial.
Oh, no. Oh,
We put the cardboard on and just use it.
Who does that?
that's what the instruction says.
Nobody does that. Got news for y'all.
There's the book way
It says crush at dawn.
and the real world way.
Whatever. Nobody does that.
I don't think I've ever
So
seen
you
one.
put this on, and it makes it, it's not super sticky, but I want everybody to feel one
Yeah.
of these. Because it's a little bit sticky. It's just enough sticky for this steri strip to stay. Now your steri strip.
listen.
Yeah.
I
So
had,
you're in.
I had that over a
Your
cut.
steri strips go on however your surgeon wants. There's a couple of ways to do this. You can take them off one by one and put them down across the wound. Some people like to do an X across the wound, or you can do 2 or 3 across. If I want to do another,
Some people like double them up going the same direction.
yeah, that's what I'm about to
Probably.
do.
Oh,
So if you're scrubbing with
they just
me
peel and stick.
and you're gonna give me steri strips, I want to pick up. I only need 2, but if I needed 3, you just use all 3. I want to pick up, and then I can put them down, and it'll be done.
Nice.
So steri strips come in these sheets like this. You have to decide how to cut them. So what I did was cut it in thirds. Usually it's halves or thirds. It depends on the size of your wound. So the fact that I have tiny little wounds here told me, let's do this in thirds.
You can always ask,
Yeah.
because inevitably if you say, oh, I'm going to cut them in half, the doctor will be like, why aren't these in thirds?
Yeah.
So,
And the other thing we can do is just a Band-Aid. Real high tech, y'all.
big band-aids for belly buttons usually